just did it. So again, I'm Leslie Herring from Happier at Home, and I appreciate the chance to talk to everybody today and introduce our services. Happier at Home is an in-home care agency. We provide non-medical care in the home. So I'll go through what we do, but our mission basically is to ensure better quality of life for our clients and their families by providing dependable and affordable in-home care. And I'll talk about affordable too as well, because we are all private pay at the moment, and people go, but there are things that we do that are actually more affordable than ways other people that need assistance are finding to do that. I'll give you an example. This is not the button I'm pushing. So our purpose is to help support anybody's independence, whether it's a loved one or yourself, and we are not just for seniors. We want people to remain at home. Who doesn't want to remain at home? Who wakes up in the morning ever and says, I'd like to be in an assisted living facility? I don't know. And we want to enrich people's lives. How we started, Happier at Home was started in Rochester, New York by a lady, very intelligent lady with a lot of letters after her name, but she started as a nurse. And she took care of her ill father and found she had a passion for doing that. And so she started Happier at Home back in 2007, built up her own business in Rochester, several locations, and then sold them to the people that were running them to focus on franchising Happier at Home locations around the country. So now I think we're in 14 states, and this is the only location in Iowa, or actually anywhere near Iowa. So while we are a new Happier at Home location, we're not a new company. So there's a lot of background and support behind us. We're not trying to figure this out all on our own for the first time, which is great. Debbie, again being the smart lady that she is, has gotten to know several other independent pharmacy owners like myself throughout the country, and has realized all of us have one thing in common, a few things in common actually, a passion to take care of people. That's why we do what we do, and a business model that is so rapidly changing in terms of our reimbursement and financial viability that we're all looking for more services to be able to provide, where prescription filling has become just a byproduct of what we do, because on the financial side of things, we don't make any money at it. In fact, a lot of us lose money at it, and that's thanks to our PBMs and our insurers, and it's a whole other topic for another day. So we're constantly looking to augment our services, which A, keeps us financially viable and open for the community, but B, allows us to do more of what we have a passion for, so it goes hand in hand. So Debbie is targeting her marketing of the franchises to partner with independent pharmacies like Sumter, and what that does is it makes Happier at Home able to provide more care in different ways than our competitors, basically, Home Instead and different agencies, because we're not doing anything that nobody's ever thought of before. We just like to think we can do it differently and enrich people's lives better. So when I talk about the pharmacy liaisonship, I am not talking about filling prescriptions for people that we're not currently filling prescriptions for. Sure, I'd love to do that, but there's a whole other list of services that our professional staff can go into the home and provide to keep people not only happier at home, but healthier at home. And that's what I'm most excited about. So what can we do? Again, it's all non-medical care. So meal planning and preparation, transportation, shopping, errands. Our caregivers can take people to doctor's appointments, and not only as a transport, but also if the client or the client's family so wishes, we can go into the appointment with the person. That extra set of ears, especially, we're so dispersed as families across the country. We have a lot of our loved ones that don't live near their children. So my mom in Scottsdale, Arizona uses a service exactly like this. Thank goodness. And it gives me and my brother peace of mind. We're not there. I know someone's seeing her every single day. looking out for her well-being and making sure that her needs are met. Housekeeping, stripping the beds, doing some laundry, light housekeeping. We don't bathe. Again, we are non-medical, so our caregivers are non-medical, so we do not transfer patients. We do not deal with Hoyer lifts, and patients have to be able to transfer with some assistance, but they have to be able to weight bear. And so we are not bathing, but we are making sure the bathroom, the shower is safe and has everything we need, and then we stand by for assist. So providing that extra safety. Companionship, mental stimulation. My mom's favorite day is Sunday because she gets a caregiver that's older than a lot of the nursing students. So she's the only one that knows how to fold the laundry correctly. And then the rest of the time they do a jigsaw puzzle. And that, my mom is, mentally slipping, and that engages her rather than just laying in bed and sleeping. We do take care of Alzheimer's and dementia patients. We encourage exercise, we monitor exercise, we can help people go for a walk. Hey, let's go get the mail together, etc. and so forth. We can walk pets. We can do short stays all the way to 24/7. We can do respite care, and that is very important. We find people's loved ones being the caregiver. I did it for my dad. It's exhausting, it's emotionally exhausting, and actually you're not the best caregiver, even though you might think you are. But somebody that truly understands caregiving and some of the aspects that go with it might be a better choice, and it relieves you. And I know when my father passed away, I was left with a whole lot of resentment, not towards anybody, but towards the world, because those last few years, I didn't have a father-daughter relationship. I had a caregiver-patient relationship, and I missed the opportunity to take advantage of that. So respite care is really important, and we do get calls for that. Like a lady, I've been taking care of my husband for 7 years, but she's active and wants to go and do with her daughter, and so we need to go relieve her. We do tailor to the individual client needs. We don't have a handbook. So how we start is by going out to the home where care is going to be provided and performing an assessment. It's free of charge. We want to make sure that we're the right people to take care of these clients, and that we can do what they need, or if they don't, then we can provide resources to find them the right place. So a lot of our building of relationships are trying to build basically a phone book of other resources that we can refer to when our patients, because they end up coming to us just like at the pharmacy. Where do I get an oil change? You wouldn't believe it, but we're one of the most trusted health professionals, so they come to us. Our caregivers are going to have very tight relationships and be the trusted ones. So it's really important that we network for that reason as well. So a bit about our caregivers. We run professional criminal background checks, motor vehicle checks, and we drug test. They have to have a driver's license. They have to have proof insurance on their vehicle that they carry, because they use their vehicle unless it's completely inappropriate to transport our clients. We drug screen. They are insured and bonded, and they are employed by us on a W-2. So that's important. A lot of people try to go the private caregiver route, and it's great. It seems like it's cheaper and all of that, but that private caregiver that they know from down the street is not insured, bonded, drug checked, nothing. So there's a whole lot of liability potential there. So how we are unique, again, I talked about the pharmacy component, and it's kind of started my tagline of not only happier but healthier in the home. So what we can do, and again, not about filling prescriptions, but what our pharmacy component can bring is medication reconciliation, for example. You go into people's homes, especially seniors, but not only seniors, found that they're on 6 medications. 2 of the 6 that they're taking are the same thing, just different doses. Probably one was supposed to be stopped when the other one started, but they're taking both. We see this at the pharmacy, but we'd see way more if we got into the homes. And we can be the liaison with the doctor's offices and whatever pharmacy they're using to, again, button that up, keep them healthier. We can do in-home immunizations. We can do in-home test and treat. So we can test and treat for flu, for strep, and for COVID. And hopefully soon RSV. We can test for RSV, but we don't have the state protocol to treat. So when I'm talking about test and treat, you have flu symptoms, I come out, I test you. If you're positive for flu, I have the authority to write the prescription for the antiviral and get it to you and get it on board right away. You've never left your home, you haven't gone to the doctor's office where you're sitting with 20 other sick people, and we've avoided hospital admissions, especially flu in the elderly, a lot of numbers of deaths. Again, back to those medication reconciliations, medication-related problems are one of the highest reasons for emergency room visits and hospital admissions.
I was just curious from the pharmacy point of view, when the doctor sends a prescription, a new prescription, and like you said, there was probably a change in doses, does he not like send, okay, remove this is what they're taking, you know, this is what they're taking, but this is what they were taking, but this is what they need to be taking?
No, most often, sometimes yes, it'll have a little note on the bottom, replace, you know, I get a prescription for rosuvastatin and it'll say replaces atorvastatin. But that is the exception. So why not? There's no good answer for why not, but that's how pharmacists play a role in your health care, not just putting pills in a bottle. So we as pharmacists and my pharmacy techs are highly trained and skilled and nationally licensed. These are highly skilled technicians that know to look and know what drugs do. They're not just typing up a label. So we will always look at the patient's profile. We will always then see, you know, not hopefully, we see, oh wait, they're on this. We need to ask the question. If the patient doesn't know, we'll call the doctor to clarify. Happens all the time. That's our job.
Yeah, I mean, just the fact that you said that there's so many deaths and, you know, so, you know, you think it'd be like a red flag. Why is this happening so many times? You know, like
right.
The overdose or
right.
whatever.
Sumter Pharmacy is a not unique, independent community pharmacy, okay? HealthMart does a great job. They're all over. Independent community pharmacies do this. Your big box stores, your mail orders, your Amazon do not do this. They do not provide pharmaceutical care. They fill prescriptions, and there's a huge difference, and you just pointed out a major example. So I am a big proponent of choosing your pharmacy carefully because there is a big difference between filling a prescription and providing care.
I'm going to insert something just real quick. Here at the health department, we have bags that anybody can have as many as they want. We've got boxes of them. But what it is a prescription, a way to get rid of
Disposal.
old prescriptions. So all you have to do is put some warm water into this little bag, drop the pills in there, and seal it up, and you squish it around a little bit, and then it's safe to just drop it in the wastebasket. And
Those are wonderful.
yeah, and there are so many people, we go into their homes and we see exactly what you're saying.
Right.
That they're,
I'm sure.
they've got bottles and bottles of medicines that are half used, and well, they don't want to throw them away because they know they're not supposed to just put them in the garbage, and you're not supposed to flush them.
Or what if they need them another day?
Yeah.
7 years later and they're expired. Yeah, that's a great point, Ann, and we do the same at the pharmacy. We have packets, they're called Dispose RX. We practically have made them bag stuffers.
Yep.
How often do you see them in your bag? A lot. So again, they're free. They're actually provided to us through the state opioid grant. And we started out just we put them in narcotic prescription bags because of the opioid problem, right? Get rid of them when you're done. And then we said, well, let's do all controlled substances. So we started doing that. And then we said, children's antibiotics. There's some left over in the bottle. Nobody wants to dump it down the drain, even though I tell them it's okay. So they go, pretty soon they become back sufferers. I mean, we go through hundreds and hundreds of them a week. I don't care if you've already gotten one, you're getting another one. Give it to a friend. They're free. And yeah, we go through a ton of them. The other thing we do through the state, I'm getting off topic, but the other thing we do through the state opioid grant is free naloxone. So to anybody over the age of 18 that can clearly comprehend the education we provide when we dispense it. So no questions asked, no judgment, free. You use it, it expires, come back, you get another free one. And we pump that out as much as we can. So if we go into a home and there's opioid risk, and you guys can watch for this as well, for all your different roles that you're in the homes, if there's an opioid risk or you need some of the disposal packets, call us at the pharmacy and we'll get it out there for you. Right? All right. So as best we can, we commit to trying to provide the same caregiver for each visit. That won't always happen, but it is a very important goal to us. We are locally owned and operated. We have a fantastic employee retention rate. Even though we're new with Happier at Home, my pharmacy staff can attest to that. Some of them have been there longer than I have, and a very low turnover. And we are committed to making Happier at Home the place everybody wants to work. So we want the caregiver saying, this is a great company, hey, come on and work over here. Because the struggle with companies like ours is getting and keeping caregivers. And when I started down this road, I knew that was going to be my biggest problem. Knock on wood, it hasn't been. We have caregivers on staff, ready to go. We have about 12 sitting on the bench, and these are all quality people. And we've done some things to make us the company of choice, and we need to stay that way. So that's a commitment. Our caregivers are our customers just as our clients are our customers. We do have the ability to provide our caregivers specialized training in dementia and Alzheimer's. So frequently asked questions, paying for services. We are all private pay. We're non-medical, so we can't bill a medical health insurance. That's the easiest way to think about it. A lot of folks do have long-term care policies. Those aren't medical insurance policies, they're for long-term care. And a lot of those policies do provide this benefit. And we will coordinate the billing of the long-term care policies. Our rates are competitive with every other agency that does what we do, with a few exceptions. 3 hours and up, we're at $35 an hour. Under 3 hours, it's $50 an hour. And the reason why is it's hard to get a caregiver to want to go do a 2-hour shift because they're potentially giving up the opportunity to do an 8-hour shift. So we have to incentivize that. And then if you think about it to the client, 1 hour goes by so fast, I mean, you're pretty much gonna need 2, right? Well, 2 hours is $100, 3 hours is $105, what are you gonna do? Right, so it's a win-win. We talked about why not hiring a private caregiver, and then how do we get started? We take inquiry calls or, meet and greet. We do events at retirement communities, things like that. So we're meeting people, but when we get called for an inquiry, the first thing we try to do is schedule an assessment. And we go into the home, not just assessing if we're the right people, but we really get to know the situation. We get to know who the potential client is and the families, because families are just as an important part of this process. And we ask all kinds of questions, like not just the basics and who your doctor is, and you have a advanced record, all this kind of stuff, but how many pets do you have? What are their names? What did you do for a living? All kinds of that type of information, because that goes in a database. The clients go in the database, the caregivers go in the database, and when it helps us do a match for the best caregiver. So if I've got a caregiver allergic to cats, it's never going to suggest a client for that caregiver that has a cat. So So we try to really, let me go back to the rates for a second. The other way we're really different is there's no contract and no minimums. Somebody wants 3 hours a week, they can have 3 hours a week. Somebody doesn't want it anymore, we have a 10-day cancellation. There's no minimum per week, there's no minimum per day at all. And we are unique in that respect.
And it can be episodic.
It could be episodic.
So, say, the whole family's gonna go to Chicago
Yep.
for a long weekend, except for Grandma can't go
Right.
along.
We need,
And that's the only time we'd ever have
Yes.
these.
yes, it definitely can be episodic. In fact, our very first client was referred by Ann, I think. And he needed a ride, he was having surgery, and he needed a ride. And so this is one way, even though we're private pay, we can be very economical. He needed a ride to Creston for surgery and back the next day. So he could get an Uber, but hospitals won't release patients to Ubers. He had maybe a family member, but that family member might have had to take off work and lose that income. Or he had us, because Ann had him call us. So at $35 an hour, it was probably a 3-hour round trip each time, 3.5 hour round trip, because he took him, and we get paid to come home, obviously the caregiver's still working, and then we went and got him. So it was a total of a 6-hour episodic client, and I can't do the math, but what's 6 times 35, a couple $100, right? It was way cheaper for him to use us than any other kind of transport. Not only that, that caregiver went to the door, made sure he got to the vehicle safely, got down there, took him in, got him checked in, gave care, not just a ride. So we think there's value there. Questions? What did I forget, Katie?
The area that we covered.
Oh, very good, yeah, and this is one of the reasons why we got into this too as well. So when we did market research, we cold called and got to know our potential competitors, right? Everybody did the same thing, people had different rates, different contracts and that kind of stuff. There was one thing the same about all of them, nobody would come to Adele. Not one had a caregiver that would come as far as Adele. Because the agencies are typically concentrated in Urbandale and around the metro, and they hire caregivers around those areas. There's plenty of work. So they can't get caregivers to come even to Adele. So now you can just forget about north of here, south of here, and west of here. There is nobody. I called someone, pretended my mom needed to move here, yada, 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 right? Don't have a caregiver that'll come to Adele. A month later, this agency calls me back doing a follow-up. Great marketing, right? Oh, just checking in, did your mom move to Adele, are you still needing to get her, blah, blah, blah. She hasn't yet, but we're getting close. But I think the last time I talked to you, you don't have any caregivers that would come to Adele, do you now? No. So, very underserved population. And what we've done is hire caregivers all dispersed around. So our hope is we get a call from Panora, we've got somebody close to Panora. If not, we pay their travel time, but that's what we've spattered them all around. So we go as west as Stewart, we go north almost to Boone, we go south past Winterset, and then we go to the east. We got West Des Moines, we've got, all the way to Merle Hay Road, basically, but that area is saturated, and this area needs care. So that, again, being my home community and the sister communities around, it really, my family's 6th generation Dallas County. My husband's grandfather, they say, was the last man in Dallas County to farm a horse. So, taking care of my community is important. I had Katie pass out the slides, a sample brochure, some sample cards, if you guys have friends that might